Are DOACs safe for stroke prevention? Imagine a medication that helps prevent strokes without some of the risks associated with older drugs. That's what direct oral anticoagulants, or DOACs, aim to do. These medicines include drugs like apixaban, rivaroxaban, dabigatran, and edoxaban. They are often used for people with atrial fibrillation, a common heart rhythm problem that can lead to blood clots and strokes. Compared to traditional blood thinners like warfarin, DOACs have some notable advantages. Research shows that DOACs are at least as good as warfarin in preventing strokes in people with non-valvular atrial fibrillation. Some studies suggest that certain DOACs, especially apixaban, might even be safer and more effective. When it comes to bleeding risks, which is a concern with any blood thinner, DOACs generally cause fewer serious brain bleeds than warfarin. However, the risk of gastrointestinal bleeding can vary. For example, dabigatran has been linked to a higher chance of stomach bleeding compared to apixaban. Overall, apixaban tends to have the most favorable balance between preventing strokes and reducing bleeding risks. Age is an important factor. Older adults, including those over 75 or even 80, still benefit from DOACs with similar or better safety profiles compared to warfarin. In fact, some evidence suggests that in very elderly patients, certain DOACs may have lower risks of major bleeding. Dosing is also key. Higher doses of DOACs can be more effective at preventing strokes without significantly increasing bleeding risks, but these doses must be tailored to each person based on kidney health and other factors. People with kidney problems or blood disorders like anemia or low platelet counts can often still use DOACs safely, but careful medical supervision is essential. It's important to note that DOACs are not recommended for patients with mechanical heart valves or significant mitral valve disease. For those who have already had a stroke, DOACs provide a safe and effective way to prevent another one, especially since they tend to cause fewer brain bleeds than warfarin. Choosing the right blood thinner involves a personalized approach. Doctors consider each person's stroke risk, bleeding risk, kidney function, other health conditions, and personal preferences. Open conversations and shared decision-making help ensure the best choice. In summary, DOACs are generally safe and effective for stroke prevention in many patients, especially those with atrial fibrillation. They offer benefits like fewer serious brain bleeds and easier management compared to older drugs. Still, it's vital to work closely with healthcare providers to determine the best treatment plan for each individual. Always consult a medical professional before starting or changing any medication to ensure safety and proper care.